and welcome to EHI TV. This is eHealth Insider's essential news on video and I'm Shanna Crispin. Last week, EHI reported that CSC told investors that they may not get a new deal for deploying Lorenzo in the North Midlands and East. What that means for the current contract remains unclear, but trusts are being left with a headache as they consider how they're going to transition from the nationally agreed contracts. The situation is not unique to the North Midlands and East, as all of the nationally agreed contracts for electronic patient records are due to expire over 2015 and 16. With me to talk about the dilemma is Brian Gorman from Channel 3 Consulting, who is involved with a lot of work with trusts across the UK. Welcome, Brian.
Thank you.
Firstly, give us a bit of an idea. What sort of responses and concerns are you having from trusts that you're working with about this?
Sure, so I think essentially most organisations are not seeing this as a surprise. So fundamentally, government remits, I guess direction from Department of Health and the concerns from people like NAO have seen that national programme contracts have not been delivering value for money. So I think general direction, organisations have been expecting this to happen. What we're seeing at the moment though is a lot of organisations that are looking at, well, what should we do? Strategically, how do we do this to align with, I guess, integration with social services? How do we do mobile working? How do we, rethink what we could be doing, rather than rethinking how do we find an alternative to the national programme? So most organisations see this as opportunity rather than an issue, I guess is the key thing we're seeing in the market. Okay,
so what sort of trends and patterns are you seeing coming out of this?
We're seeing, I think, the clever organisations are rethinking strategically. So rethinking what's possible, what's the art of the possible, rather than just replacing my PAS or replacing my EPR. Can I work with local authorities? Can I work with commissioners? Can I have a shared care record? So also looking at, I guess, from the financial and austerity side of the NHS, what can I do better and get better value for money from? So even though the onus is now placed on the organisations to find the funding for these new initiatives and procure their own systems, many are finding clever commercial approaches to finding better solutions at actually less cost than what they're currently spending. So we do see this as opportunity for the organisations, and I think most are not surprised, but most are fundamentally stepping back, rethinking strategy, rethinking commercial approaches, and rethinking healthcare provision. Can I do it better?
Okay. So in your role, you get a very good oversight of what's going on. What's going to be successful in your view?
What we're seeing are, as I say, strategic rethinking, and there are organisations that are looking at everything from, can I stop inpatients into my organisation? How do I stop people coming in? Can I look at internet TV? Can I look at Facebook delivery? Can I look at innovative technology systems that really impact healthcare delivery? So bringing my services out to the market and stop trying to do PAS as we used to do PAS. So I guess it's the ones that strategically realign the business, look at the technologies that the organisation need going forward, are really the ones that are seeing clever solutions coming out of this. So.
Okay. Now, you could say that because they've been nationally agreed contracts, trusts have had a little bit of help in getting this. Is there any concern that maybe they don't have the expertise or experience?
Yeah, what we're finding is in a lot of scenarios there are, I guess, a lack of skills around strategic ICT and particularly around community side. So, the vision of the government around community functions working together. So you see very few people working with local authorities, working with social services, integrated working in a community. So from strategic ICT right through to commercial negotiations. So how do you procure 30, 40, 50 million pounds worth of service in a sensible manner that allows you to be an intelligent customer, manage a big supplier, and get good value for money? So we're seeing a lot of need in the market for, supplier management, contract management, commercial negotiation, and strategic thinking and partnering with suppliers and community-wide organisations. They're really where we're seeing gaps at the moment. Demand is quite big, the contracts are impacting nationally, so there's a huge number of organisations. So we're seeing some collaborative initiatives, so some organisations in similar care settings, some community-wide, starting to work together to bring those commercial skills together and say, can we get better economies of scale, for example? So challenging market, challenging times, but fundamentally the biggest opportunity to transition everything to support a new model of healthcare.
Exciting times ahead.
Very.
That's all we've got time for on EHI TV this week, but be sure to catch us next week where we'll be discussing the mHealth ecosystem in Manchester.